Well, hello and welcome everybody to the first of hopefully many MDH Speaks events. I'm Anna Strain, the Infectious Disease Lab Manager at the Public Health Laboratory. The Minnesota Department of Health has a long history of serving Minnesota since the first State Board of Health was established in 1872 in Red Wing. No longer located there, but it's a lovely town to visit. So the goal and the responsibilities of the Department of Health have been the same since it was first established. So to assure the health of communities by keeping track of births and the causes of death in the community, to establish policies and practices that help to limit the spread of infectious diseases, and to assure sanitary conditions so that the environment remains safe for healthy communities. The health department has numerous divisions and programs that help to maintain the health of Minnesotans. But today we're going to focus specifically on the public health laboratory, more specifically on how the lab and supporting services help to utilize the power of science to keep Minnesotans healthy. We have 8 amazing speakers today who work in various positions throughout the laboratory, and they each bring a unique perspective to the work that they do and how that helps play a role in engaging with the community and keeping Minnesotans healthy. So in addition to our amazing speakers, this event is possible today through community partnerships that have been established with the Public Health Laboratory. We want to thank St. Paul College for opening up this space to us that allows us both to invite people from the community in, but also to be able to record and share this event later. So thank you for that. Our community outreach program works very closely with public schools to bring science education opportunities into the classroom. They've been working specifically this year with Heritage Public School, the wonderful staff and students there, to help them explore scientific discovery. So with that, the most interesting part of today is going to happen next when we turn this over to our speakers. There's going to be a little bit of juggling between microphones, so bear with us as we make that transition. And I want to turn this over to our first speaker, who is Ray Erickson from the Infectious Disease Laboratory, bacteriology laboratory specialist that specializes in focusing on diarrheal diseases. And his title today hasn't changed. I don't see the slides up yet, but it's Sundaes to Sonic, a history of fighting Minnesota's outbreaks. So with that, I'll bring Ray up. Thank you very much.
Ground shows open. It was a brisk morning, late September 1994, one of the first days of fall and coldest since the previous spring. Refrigerated yellow trucks start their engines and begin their normal routes around the upper Mississippi Valley, through Rochester and the college towns of Northfield and Winona, all over rural southeastern Minnesota. Normally, these trucks carried ice cream, but today, something else was traveling with them. A few weeks later, a medical detective with the Minnesota Department of Health named Craig Hedberg started to notice a trend. A common and unremarkable strain of salmonella called Salmonella Enteritidis had begun to pop up in the lab. In a little more than a week, more than 30 cases had come through the MDH lab. There were less than 100 cases in all of 1993. Craig knew that diarrheal diseases are vastly underreported in the United States. People rarely seek treatment for diarrhea, and those who do rarely have their stools analyzed in 1994. So Craig knew that 30 cases wasn't 30 cases. 30 cases in that short amount of time was the tip of an iceberg. He made a phone call. Craig Osterholm was a state epidemiologist from Minnesota when he answered the phone in 1994. Under his tenure, he'd made foodborne diseases a special priority. And through his leadership, clinical labs around the state had begun to routinely send samples to the Minnesota Department of Health's Minneapolis lab for confirmation and serotype testing. Osterholm was a fan of the phrase, "Mother Nature gives us opportunities to learn." 1994 would be a big learning curve. After that phone call, Osterholm and Hedberg initiated a case control study on the Salmonella Enteritidis patients. They were asking about common events, common locations, common restaurants. They were looking for a common source. They asked about meat products. They asked about canned fruits and vegetables. They asked about leafy greens. But mainly they asked about the most common cause of Salmonella Enteritidis, eggs. But what they found surprised them. 3 people they called had a common source. but it wasn't what they expected. It was ice cream, but that didn't make sense. Ice cream is pasteurized. But when 11 of the first 15 people they called had also eaten that same type of ice cream, they knew they had to act fast. 2 days later, Hedberg, Osterholm, and representatives from the Minnesota branch of the FDA were in a conference room with the representative food company. The FDA had never initiated a recall based solely on epidemiological data before, but at that meeting, Osterholm gave an ultimatum. Either you put out a recall statement by this evening's news, or we will. 2 days later, garage doors open. Refrigerated yellow trucks start their engines and begin their normal routes around the upper Mississippi Valley, through Rochester and the college towns of Northfield and Winona, all over rural southeastern Minnesota. Normally, these trucks delivered ice cream, but today, they were collecting it. It announced its largest recall ever, nationwide. It closed down its production facility in Marshall, Minnesota, and sent letters to all of its customers to either discard or send back any unused product for testing. After this happened, cases began to slow to a trickle. But the MDH estimated that as many as 30,000 Minnesotans could have contacted Salmonella Enteritidis. Over 200,000 Americans nationwide. The largest single-source Salmonella outbreak in the history of the United States was winding down. But the search for that source was still underway. Technology can often be a frantic march towards faster, more powerful processors, information transfer. Science can often be a steady walk toward a different target, sensitivity. See, most data sets, from infectious disease rates to the weather, have this baseline, this common unremarkable average that makes up most of the data. And it's only when something rises above this baseline, rises above a threshold, that it's noted, that it's investigated. And that's where a lot of science is working, to lower the threshold for investigation so we can more easily find the signal through all the noise. Whether that's screenings for cancer, like the one that took my grandmother, or screenings for or early detection for the Alzheimer that took my grandfather years later, or the newborn bilirubin screening that detected the jaundice in my son before we even left the hospital. Now going home with a cool light-up blanket. In 1994, the threshold for Salmonella Enteritidis was high, but Salmonella Enteritidis is one of the most common serotypes of Salmonella. But the 94 outbreak was about 10 times normal background. What if it had been 2 times? What if it had been 1 time? Would this have been missed? This is an actual quote from the CDC in 2019. Don't kiss or snuggle hedgehogs. Doesn't make a lot of sense, but in the previous 3 months, the infectious disease community from around the country was winding up a different infectious disease mystery. A national surveillance network had linked together 11 different samples from 8 seemingly random states with no obvious source of, with no obvious common source. But here's the thing, 1 or 2 samples in each of these states was well within background, well below a threshold. So how was this detected? Why are we talking about it? What changed? Our thresholds. In the previous 30 years, scientists have been diligently working to lower the threshold of detection. It used to be a couple times background, but now it's 5. Not 5 times background, not even 5 samples, 5 alleles. 5 genetic differences or fewer between 2 bacterial samples that come into a lab and we investigate. This often can be only 2 samples. These can be weeks apart, hundreds of miles apart, but we investigate. They investigated. In 2019, the CDC and state health labs from around the country looked into the typhimurium cases. They brought back the questionnaires. The questionnaires asked about purchases, traced back to those purchases, led to an uncommon common source, hedgehogs. When lab technicians from the Minnesota Department of Health linked samples from 3 hedgehogs to their 2 ill owners, the whole case kind of clicked into focus. Overall, 84% of those who reported this sickness reported contact with hedgehogs. Who are these people? 54 cases total across 23 different states over a full year's time with a relatively common serotype of Salmonella. That's lowering the threshold for detection. That's making progress. Investigating the source of an outbreak used to take thousands of hours, both in the lab and in the field. It still can, but today, what used to take weeks can now take days or hours. What used to be a hunch is now a national surveillance network, updating in nearly real time. Devoted lab scientists and epidemiologists are still here, but now our tests are more accurate, our results are quicker, our targets are more precise, and every day, more and more of the data that we generate is captured and fed back into these national surveillance networks to better connect and track outbreaks in the future. Tracking the source of an outbreak can still be hard work, but every day we're in the lab, we're making progress. Every day in the lab, we're becoming more efficient.
I almost forgot, what was the source of the Salmonella outbreak in 1994? After months of investigating, the Minnesota Department of Health and the FDA cleared the facility, completely cleared. They also cleared the facility that made the base products for that facility and then shipped them to the facility. They pasteurized prior to shipment, so they were clean too. So where was the source of the contamination? In the shipment. It used to be that under an old contract, the base products were shipped down to the Marshall facility and then unloaded and traveled back empty. Under a new contract, they would continue south and pick up a second load to return back full. This was more efficient. So what was in that second load? What was sloshing around in these tankers, getting between every metal seam under every rivet? Any guesses? Eggs. Raw eggs. The most common cause of Salmonella Enteritidis in 1994, the most common cause today. See, sometimes efficiency isn't always progress, and sometimes, with all of our progress tracking infectious diseases, some things never change. Thank you.